and I'll be guiding the seminar this afternoon. First, I would like to express our gratitude to the Advisory Committee of Mental Health. The Advisory Committee of Mental Health of the Health Bureau for their generous funding and support. Without their assistance, today's event and the significant impact we were able to achieve through this project would not have been possible. We are pleased to co-host today's event with the Research Office and the Translational Research Center of the Digital Mental Health. We are honored to have esteemed guests joining us today, Professor Sally Chan, President of Tonghua College and lead investigator of the project. Professor Rick Guan, Associate Dean and Professor of the School of Nursing and a member of the project team. Dr. Fo Yim, Associate Professor at the School of Management and a valued member of the project. We also have two external guests joining us today, Ms. Wong from Integrated Community Center of Mental Wellbeing and Mr. Lo representing Kwai Tsing District Health Center. They will be sharing their valuable insights on implementing mental health programs for older adults at the community level during the second part of our seminar. Please note that today's seminar will be conducted entirely in English. However, for the group sharing session which follows the presentation, we will be switching to Cantonese Chinese. For our English-speaking participants, real-time translation will be provided in the Zoom chat box of the event. Any attending participants, please log into the Zoom room using the ID you received and join us for the conversation. Our first speaker is Professor Sally Chan, President of Tonghua College, lead investigator of the Digital Buddy project. Professor Sally Chan is an internationally renowned scholar in mental health care and nursing education and has published over 400 publications supported by more than 100 funded studies. Let us warmly welcome Professor Sally Chan to the stage. Thank you.
Thank you so much, Manfred. A very good afternoon to all of you, for those who are present in the room and also to all those who are online. I know that for the participants online, some are from overseas, so thank you so much for joining us. First of all, I have to say that it's indeed my great pleasure and honor to be able to present the study to you. This study started 2 years ago, and I have to thank the Advisory Committee on Mental Health from the Health Bureau for funded this project. And I'm also honored to be able to work with an esteemed team, Dr. Fo Yim, Dr. Edward Mant, Professor Joyce Chin, and also Professor Rick Guan. So today, what we are going to do is, first of all, I will briefly present the background of the study and the design of the our Digital Buddy program. And then I will invite Dr. Fo Yim to present the implementation process. And then Professor Rick Guan will provide a brief information on the evaluation of the project. And then we will come to a Q&A session. Okay, so I will start with the background and also the app development. All of you will know that all over the world, we have an increasing number of elderly population. And some of you may know that in the future, majority of the older people will be concentrated on South Asia region. It is because of longevity in this region and also a reduction in the productivity of new people. And how about in Hong Kong? We know that by 2050, 1/3 of our population will probably over 65 or above. So that is an issue that we need to manage. And 2 years ago, I read something on newspaper. It said that, yes, it's good that Hong Kong people are living longer, but not necessarily healthier. So would it cause an extra burden on healthcare? And of course, we know that when we are getting older, some of us may have more chronic diseases. But from my sort of experience and my thinking, it is not necessary that it would happen. If we can do something now, we can promote our health, and hopefully when we are getting older, we still can maintain our health. So although we predicted that when we have more people, they will cause extra burden on our healthcare, but we also have to firmly believe that we can prevent this from happening, and we can make things better. When we talk about health, we are not just talking about physical health. We are also talking about mental health. I'm sure that you have heard about this term. There's no health without mental health. This statement was said by Dr. Brooke Treason, who was the first Secretary General of the World Health Organization. He famously coined this statement, in fact, in 1948. In fact, half a century later, we have a lot of evidence to support the bi-directional relationship between physical health and mental health. We now know that if people have depression, they are at high risk of having coronary heart disease. If a person have depression and also have diabetes, they will have worse symptoms from both diseases. So that's why when we talk about health, it's not just physical health, but also mental health. So what is the mental health of older adults all around the world? The World Health Organization has conducted a study a few years ago, and it estimates that about 14% of adults aged 16 or over live with a mental disorder. It includes dementia, anxiety, depression. And it is also well known that loneliness and social isolation are the key risk factor for mental health condition. And we also know that mental health is as important as physical health at any age, and of course in older age as well. So that's why we are thinking how we can promote mental health for our older adult. Then what's the mental health condition in Hong Kong? Before we go into that, we have to talk about COVID-19. Yeah, so we know that during COVID-19, apart from physical health, mental health is also being affected at that point of time. And it is also believed that, and now we have more evidence to show that the aftermath of COVID-19, although the infection appears to be a bit far away from us, but the consequence of COVID-19 for a few years' time, in fact, have a lot of complication that cause to people, especially in mental health. And especially for older people, because we know that during the COVID-19, we have social isolation, and this social isolation have a bigger impact on older people than younger people. So that's why COVID-19, in fact, had more impact to older people's mental health than younger people. And in a study that was conducted in Hong Kong during the pandemic period, it was found that older and less educated people tend to have deteriorated mental health outcome when compared with younger people. So that's something that we need to pay attention. And so if we look at some studies conducted by the Jockey Club, Hong Kong Jockey Club, in 2020 and also 2022. In 2020, the study showed that about 10% of older population in Hong Kong may have depressive symptoms. And in 2022, a follow-up study showed that there are more people, older people in Hong Kong said that they may have symptoms of depression and anxiety. So that is something that we need to pay attention to. And in 2019, Dongwa Group of Hospitals conduct a survey on older people's mental health in Hong Kong. In that survey, they provide some recommendation. First of all, they said that because of COVID-19, there's a lot of social isolation and loneliness. That's why we have to include loneliness in the mental health agenda. And it's also important that we can help to enhance the social skills and social connection of older people and increase intergenerational quality time. That means we need to promote the time between older people and younger generation. And that would contribute to better mental health. And if we look at the report of World Health Organization, it also confirmed that social isolation and loneliness are risk factors of poor mental health. And it recommended that social isolation and loneliness can be reduced through face-to-face or digital contact. So that's why after we read this report, we thought that in this present era, we have so much advanced technologies. Can we use digital technology to help older people to promote their mental health? And so that's why we consider whether it's possible to do that. And of course, when we consider this present project, we have to ask that ourselves. Yes, we talk about digital mental health. We talk about it for a few years already. Does it work for older people? And especially, does it work for older people in Hong Kong? And if we look at literature in different parts of the world, we found that there are evidence supported that technology can help older people's mental health and also help them to manage their medication and help them to monitor their health better. In fact, the New York Times also said that learning new technological skills can help older people to lessen the isolation because it helps them to connect with the world and also keep the brain active and allows them to monitor their own health more closely. So that's why there are already some research evidences to support the use of digital technology to promote older people's mental health in other parts of the world, but not in Hong Kong. And if we look at the digital inclusion for older adults in Hong Kong, so this was, the statistic was provided by the Hong Kong government. And we know that during the COVID-19 period, everybody have to have a mobile phone. Otherwise, yeah, you could not get anywhere. So we found that when compared with more than 10 years ago, in the year 2020, around 66% of older people, in fact, have used the internet. And 68% of older people that were being surveyed had a mobile phone, smartphone. But from the figure, we also know that there are more than 30% of older people who might be digitally excluded. Yeah. And even for those who have a mobile phone, whether they know how to use the full potential of the phone or whether they know how to use the phone to promote the mental health or to make connection, we do not know. So that's why at that time, we have in mind a project. Can we make use of the mobile phone to help older people to promote their mental health? And if we have to do so, how can we achieve our goal? So we have a review of the literature. So this is a systematic review related to digital intervention for older people with depression and anxiety. So in this review, it said that if we want to develop a digital intervention, there are a few factors that we have to bear in mind. First of all, it's ease of use, whether it's easy to navigate. And it is not just to give an app or give a piece of technology to older people. There must be opportunities for social interaction. That means you have to bring them together, have a people interaction, and also have human support. So it's not just, I have an app, so you use it. It's not like that. You need to have human support and opportunity for social interaction. And the digital mental health intervention have to tailor to the participants' needs. That means if we have to develop an app, the app has to fit into the needs of older people. So with all this in mind, And because Tonga College is an educational institute and we have so many young students here, so we are thinking whether we can integrate everything together, technology, older people, our younger people, and also mental health. So that's why we come to the an idea of a project which we would like to use technology to help older people to improve the mental health. And at the same time, we also want to use our young students to help the older people to use this technology. So the objectives of this project are threefold. First of all, for older people, there are two types of literacy we want to enhance. First is digital literacy. We want them to know how to use the technology. The second part is mental health literacy. We want them to know what is mental health, what it takes to enhance the mental health. And we also want to enhance the mental well-being, the self-efficacy, that is the confidence of using the technology, the feeling of social support, and also the quality of life. And we also hope that through this project, we can reduce the level of depression and anxiety. So that is for older people. And then for our young students, our digital buddies, we want to equip them with the skills of teaching and communication with older people. We also want to enhance the mental health literacy, and also they have to know about the health resources available to older people. And for both groups, we want them to develop a longer term relationship, enhance the intergeneration connection. So it's not just for the period of the project. After the project, we hope that they will continue to connect and to support each other. So these are the objectives of the project. And on the whole, what we want to do is to build a one-stop e-learning platform. So we build an app and also a web to promote digital and mental health literacy for older people. And then we train our young buddies in communication, facilitation, and also the project. So each young buddies have to participate in a training workshop for 30 hours. And then the young buddies will facilitate the older people in a group learning sessions. It's not just individual, okay? They'll have to learn in a group. So each older people in this project, they will undergo 3 to 6 months training. Yeah, altogether is about 14 sessions, and each session is around half an hour, 1.5 hours or 2 hours, and total 23 hours. And after we have done all this training session, we also will evaluate the effect of this digital buddy program. So that's all about this project, okay? That's what we have done. Okay, so the first step is to develop a digital buddy app. So it is an app, and we also have a web platform. So you can see it is very easy to navigate. We have we call a psychological journal. Okay, so older people can go into this journal every day and then mark the emotion, whether they're happy, they are not happy. And then we also have 2 big sessions for older people. One is mental health literacy, and the other is digital health, literacy. So altogether in this app, we have 73 barrier-free learning videos related to various topics: digital literacy, mental health promotion, brain exercise, cognitive training, and also related to emotional management. In fact, now we have already opened the app, so everybody can download the app and you can go in without password and username, okay? So you can do that after our presentation. And you can see that we got different session for different topic. For example, digital literacy. We taught older people how to use WhatsApp, how to use WeChat, how to use the phone to take photos, how to view YouTube and how to use Gmail and how to edit photos and so on and so forth. So for each session, we produce a very short video to teach them how to do. And of course, during the session, our young buddies will teach the older people how to do. But after they finish the session, they can always view these videos again and then try to do it on their own when they are at home or when they have time. So we produce all these videos by ourselves. And then on top of digital technology, we also have mental health literacy. And so in this part, we also have different videos. Some videos are produced by other institutions that we can use it. There's no copyright issue. And we also produce some videos ourselves. So this video contain information about mental health. What does it take to promote their own mental health, how to manage the stress, cognitive training, and so on. And we also produce a short video clip to teach our young buddies communication skills, interpersonal skills, how to communicate with people with mild cognitive impairment. So this part is for our buddies. So remember, we said that all our buddies have to undergo 30 hours training. So on top of face-to-face, they also have to view the video and learn, have self-directed learning. And apart from mental health literacy, digital literacy, we also provide them with some useful resources. For example, HA Go and Yi-Gin-Tong eHealth, or the elderly card plan, that sort of thing. And because these are the apps that older people may use it quite often. For example, HA Go, we teach them how to go to HA Go to book an appointment and all that. So we also have that in our app to, so we teach them how to use this app so that they can use it when they have a need. So all in all, who benefit from the project? And so far, for the whole project, we have trained 157 young volunteers. They are all our students as digital buddies. And so we ensure that they have the communication skills, teaching skills for this project. And so far, we have recruited 1,065 older persons. So we provide them with skills in digital technology, mental health literacy, and hopefully through this project, we can enhance the mental well-being. Okay, so these are the background of this study. And from the conceptualization, and we build the app, and we train the student, and we recruit the older people. And so we have completed the project. And of course, it sounds very easy. So it's a 2 years project. So now I'd like to invite Dr. Fao to provide you with more information about the implementation part. It sounds very easy that we have completed the project, but it takes a lot to complete the project. So Dr. Please.
Okay, thank you, Professor Chen. As what Professor Chen has said, it is not an easy task. Just imagine 1,000 something elderly plus 100 something buddies. So in our Chinese society, if we have a banquet, 12 people on the table, how many tables would that be? 100. Okay, so our team, when we got the news that this program is approved, we are very happy. But then what's next is how we are going to attract those people in terms of the older people as well as the younger buddies to join our program. So especially how do we select those people? Bear in mind we should be fair in age, locality, and also partners, right? So we start with our existing partners, and those partners like those we have today, as well as those who are not present today. Especially thanks for their contribution. And then we also have a small private elderly care center, which we call some of called the RCHE. And also, so starting from a few cards already, some of the participants, they will introduce to their friends from the word of mouth. Indeed, when I visit the cars, I'm quite surprised to see that some of the couples coming together, and also both sisters come together, and also we have a very also some people who join second time. Okay, so because of a very useful experience that they have. So these are some of the photos that we go to. So directly to the community center or go to the nursing home. And some of the classes will be held in our Dong Hwa College campus. So that's why our staff, our students have to travel around Hong Kong. So for example, this is the first day you can see me in the Sky Garden in our Mong Kok campus. And also some of the moments that we are in the class. Now, if you notice that all of them raise up their hand, what are they doing? So we add something to get the interest of the class, not just learning, but also do some physical exercise. So they all love it, and even the instructor love it. So this is also for physical health as well. So, and then we have invited elderly care organization, 73. But some of them are interested, some of them are not interested. So that is the reality. But luckily we got to fulfill what we are required to or have at least 1,000 elderly. So we are over target by a little bit. But of course, the main thing will be we also open this platform to the public as well. That means more and more people can get the benefit from this. Okay, how about our student? We talk to our student. You know, we have a lot of different programs in Dong Hwa College. Some are health related, some are not health related, but we all open. As long as they are older than 18 or above, okay? Because they have to go outside to do the field work. So we are lucky enough to have our initial target is 100 young digital buddy, but we recruit more than that because some of them may have examination, they may have assignment and class. So we better to have a bigger pool of digital buddies. And they undergo our training. They also, we find that 73% belongs to nursing program. And then we also got other programs in applied gerontology, health information and services management, and so on. So during the younger volunteers training section, so they have to attend physically 8 hours. So including, so they're going to learn how to communicate with older people effectively. Okay, so although they may say that I know, but in the reality, what kind of things that you will be facing? For example, how do you address the name? So how do you avoid some physical contact? Especially during that time in 2022, if you still remember our first picture, all of us are still wearing masks. But new tourists now, so we don't have to wear masks now right now. So it's optional. So we train them to understand the bio, psycho, and social model of aging. So that means the student learn something about this. Some of them, they may have studied in the class before. So this is also their revision. And more importantly is both verbal and non-verbal communication, as well as so to maintain a professional boundaries. So many of the buddies told me that. After this, they also learn a lot from the conversation and also treat their family members better. Okay, so if you see the pictures here, so the buddies have to wear a glass that we have some kind of obstacle so that they cannot see so well. Okay, so just like pretending they are elderly and use their finger, why they have to use a glove? Because according to research, some of the elderly people, they cannot easily use this touch screen mobile phone because of dryness of their finger. Okay, so we can simulate this situation, letting the younger buddies to know that this is not always as easy as what they done every day. And then we have also the facilitator, like Manfred and also our staff, who will be also helping to lead some of the training. And then while at the same time, the buddies will be forming into small group with 6 elderly people, to help them in terms of any question. Indeed, there are a lot of questions, not any, many questions from them. So we are also using this learning cycle so that the student and also the elderly adults is using the having the experience to reflect and then to come up with some conclusion as well. So we have some theoretical background of their learning. So what are the implications? So it did provide promote a deeper voluntary commitment of our younger buddies. And also that they will be also willing to join without a lot of drop-aways. And then they also sense their satisfaction. Some of the buddies sharing that what they have learned and what they enjoy to communicate with the elderly. And also the word-of-mouth effect to generate higher recruitment rate. So that's why we're able to recruit more people. To give some intense incentive for our buddies, some of my students here. So we also give them a certificate, so to give them the community service hour that they can claim during their study, because every student in Dong College, they have to commit a certain number of community service hour before they can graduate. So what about the other implementation issues? Now, if you look at this map, so whenever we got some yes from the partners, so we will put it in the map so that we can see so whether we can spread over to many localities as much as possible, because we have limited resources. We try our best. So you can see that Hong Kong, Kowloon, New Territory, so we can cover a lot of different areas. And majority of classes is actually held in Kwun Tong and Wong Tai Sin and Yau Jin Bo. This is not surprising because there are more and more RCHE elderly homes, and the population the FHA is more higher in this area. What about the opportunity? So older adults often lack the formal knowledge of digital literacy and mental health concept. Now, especially some of the reality in a car is that some elderly have an Android phone, some have a OS version. Okay, so when we ask them, do you know how to use it? They can just say that they can only use the on-samsuhan for the going to the restaurant during the COVID time. But for those more sophisticated things, they do not know. And when we ask them, do you have any people to ask? I want to ask my family member, but my family member won't tell me. So that is the truth in Hong Kong, right? So that's why I think this is very useful for them. So that is the a lot of opportunity for for them to learn. Indeed, many of the graduates ask, do you have any more classes coming? But what about the challenges is that number of older adults that we need to recruit, and the young volunteer that we need to recruit, especially they have a lot of assignments and exams coming on. And we have different level of difficulties in terms of the older adults' learning ability. For those who are staying in the nursing home, so their level is lower. So we have to adjust the content accordingly. So although there are the COVID issue, people have their mobile phone, but surprisingly, it is not 100. So the funding is good enough to fund the project to purchase some useful mobile phone that we can lend to the older people in case they do not have a proper mobile phone. All right, with a SIM card as well. So right now, as the project is coming to the end in this month, so we also have a plan to distribute the smartphone to older adults without a smartphone or those who are in very need. For the sustainability, so the fund also asks us to think about when you finish the project in 2 years' time, what's next? Okay, so and then we, as Professor Chen has said, we have already opened this both the web and also the apps for people around the world who can use it. You can download it and then make use of it. So it is already. And then we have already updated a little bit of thing as well to have the new version. So these are the implementation challenges as well as the opportunity. So I would like now to invite Professor Rick Guan to talk about our research and the program, the project evaluation. Thank you.
Thank you very much. Good afternoon, everyone. So it is really a pleasure to share with you that with this wonderful project. Thanks to Professor Chen shared the background of this project, the idea, how this idea was developed, elaborated, and also how the project was implemented. So to my part, I'm going to share with you how this project is being evaluated, how is it mapped with what we intended to yield the effects and all the wonderful outcomes. So basically, this research project, we have two important objectives. The first is to examine the effect of this digital buddy program on 5 outcomes. They're all mental health related, talking about mental well-being, the most important one, and the depressive symptoms, health related quality of life, self-efficacy, and social support. And also, we want to know the process, what's happening inside. We also conducted some qualitative interviews, analysis to explore the participatory experience by both the older people and the younger volunteers. So I will report these 2 parts. All right, so for the first objectives to evaluate the effect of these interventions on the 5 outcomes, we conducted a cluster RCT to rigorously evaluate that. So before we start, I want to talk about, we actually conducted this survey on more than 1,000 older people, but we do not need 1,000 older people to be recruited for study purpose. So we just sample a subgroup of a few hundred people to participate into this study. So this is the randomized control trial, cluster-based and multi-centered. And also it is only accessible because obviously the interventionist and older people can't be blind practically. And this is a 2 parallel groups, parallel trial with the group allocation ratio 1:1 and a non-inferiority trial. This protocol has already been registered, and also the protocol has been already published in BMC before we start the intervention. So for the study setting, so this study was conducted in the community centers for older people, divided basically into 3 parts. The first is in the district elderly community centers, neighborhood elderly centers, and daycare centers. They're all community-based services. And then another one was conducted in the long-term care facilities, mainly included the care and attention home. We commonly call them CNA homes. And for the participants, we can divide it into 2 parts. Of course, this indicated they're older people. They are all over 60 years, simply because the members of these community centers, they must be older than 60 years. And then they need to speak Cantonese, because all the program were conducted in Cantonese, and they are not mentally capacitated. One of the focus is we want to promote mental health well-being, but not treating severe mental illnesses. So we just excluded those with these conditions. So for the interventions, in the intervention group, this is a very long, actually, intervention. So in terms of period, the dose is altogether, we conducted 23 hours teachings to the older people by the young body, divided into 14 sessions. So altogether, after that, within this 6-month period, the young body follow them through during this 6-month period, using tele supervisions like in WhatsApp, communicating with them, because we can't meet them very regularly. We use the technologies, we torch them. And also the interventionists, who are the interventionists? They are all our digital buddy, that is the TWC volunteers, younger volunteers. And the training objectives were twofold, as just mentioned by Professor Chen. So we trained them the ICT skills with all these contents, and we also trained them their mental health literacy skills with all these contents on. This is a two-component intervention. So the materials included all these interventions, all these materials is uploaded to the web, so we can conduct them online, or they can download the app onto their smartphone so that they can revise learning them. They're all self-guided, self-paced, because they can simply just watch the video to learn all those contents without needing to asking people's questions. So compared with what? We compared with this as we employed a waitlist control. So during the waitlist period, they receive no interventions, but we do not interfere what activities or interventions provided by the community center. So as mentioned, we evaluate 5 important outcomes. They measured both at baseline and also the week immediately after the intervention. Mentioned that the intervention lasts for 6 months. So the T1 was measured in the week immediately after this 6-month period. So the first it's also the primary outcome, that is mental well-being. This primary one, we used the WHO-5, which is very well-known instrument measuring mental well-being. Depressive symptoms, we use PHQ-9. Health-related quality of life, we use the SF-12 version 2. And for the self-efficacy, we used the GSES-10, which measure very general efficacy only, but not specific on digital literacy or use smartphones. And also social support using the 12 items, multi-dimensional scale of perceived social support scale. So for the sample size, we before we started, why we didn't employ the 1,000 something samples, because we have a very precision sample size estimations. We used the G-power using the mean difference between 2 groups package, setting the level of significance at 0.05, setting the power at 0.8, 2 group 1-to-1 ratios. We estimate the effect size between after the interventions as Cohen's D at 0.5, because we make reference to similar studies published by Yun 2002. We also adjusted the effects of the clustering, because we use clusters randomization. So we assume that we have a fixed equal size number of clusters of 6 with an ICC of 0.01. We also factor in a possible drop rate of 20, because this is usually some people would have a drop out. So we estimated that we need 292 samples to illustrate the effects we just hypothesized, with 146 participants in each group. So we conducted a sequence of generations because this is block randomizations. We don't need a lot of randomized numbers. So we generate 6 randomized blocks by using just Excel random functions and allocate them with the process. Allocate them in every block. The first 3 is interventions, the last 3 is control, and resequence them the random number according to the ascending order. We also have a measure to do the concealment mechanism. That is the random list kept by independent research assistants so that the person assigning the group do not know the sequence in advance or prior to that. For the implementations, after the completion of screening and data collections of the whole entire cluster, we assign whether they are in the control group or intervention group. So the group label is assigned according to the random sequence we just mentioned earlier. So the blinding, as I mentioned earlier, we can just blind assessor, outcome assessors only, but not the participant, not the statistician, and also not the interventionist. For the statistical methods, we describe the baseline data, the demographic outcome at baseline, according to the level of measurement. For example, continuous, we use mean, and then for the categorical, we use frequency and percentage. So all by group, compare the balance between groups. We also conducted to describe them. We also conducted inferential statistics to test those 5 hypotheses, applying the concepts of intention tree analysis. We used the GEE model using setting the dependent variable using the 5 outcomes, independent variable using 3 factors, group, that is 2 level interventions versus control, time, because we have 2 time point baseline and also T1. And we also want to know the interaction term built by time, by multiplying the group by time, simply because we want to know whether the improvement by the group is better than the improvement by another group. So because we expect to have missing data, we just simply use the GEE to estimate using the maximum likelihood method to estimate the missing data, which is also a common practice. So we eventually recruited not only 6 clusters, but 15 clusters, simply because we need to achieve the number of samples. So we assessed 511 people for eligibility. We excluded something like this, and we eventually identified 310 eligible participants. We randomly allocated 2 clusters, 7 clusters in the intervention group and 6 clusters in the control group. And then we followed through because we adopted intention tree analysis. So we evaluated, included all participants in the analysis with their missing values replaced by or managed by GEE. So here are the baselines, simply because this is a cluster randomized control trial. So sometimes you just can't control the baseline balance between groups. So we can see that we have quite something difference between intervention group and control group. So for example, you can see that the control group here is much older, and then we can see that slightly quite more female in the control group than in the intervention group, and also. Another important factors you need to consider is that we usually have more people using internet in the intervention group than in the control group. And also something like the ability to use smartphone. Usually in the intervention group, they are more likely to have the capability of using smartphone is higher, something like that. So simply because you randomize by cluster, by chance that some cluster being randomized to intervention group, they have a relatively higher or better internet usage. And we have some missing data too, particularly in the T1 and in the T0 in the follow-up period, simply because some other people, they refused to complete those outcomes, but not very severe in there. So here are the important outcomes. You can see that. So for the WHO5, compared with the baseline in the intervention group and control group, we have a quite comparable baseline. But obviously, you can see that in the for the WHO5, there's a mental well-being. We have got a significant improvement after the completion of the interventions. We have also slightly improvement in the control group too, but this change is not significant. Probably you ask why. I'll probably explain you why possibly this would happen. And also we can see that the reductions of depressive symptoms in the intervention group is dropped significantly. But we can also see some decrease of the depressive symptoms in the control, but that is not significant. So here are the two important outcomes that we want to discuss later. Okay, so the another part of our study was to evaluate qualitatively over the process. We conducted focus group interview. So we conducted 14 rounds of semi-structured focus group interviews between March 2023 and October 2023. 31 older people were interviewed, 31 young volunteers were interviewed in the group of 5 to 6 in one group, led by the project facilitator. Interview lasted between 15 to 20 minutes in each round, and surveyed participants' experience in the participations of this program, and interviews were recorded and transcribed by the project assistant and also stored in our cloud drive for further analyses. So simply we adopted the thematic approach analysis via the long table approach, and we developed it and sorted the relevant themes on using the word processors Microsoft Word. And the two research members analyzed the data and also reviewed those themes. And then the third project member who was not involved in the data collections, we reviewed the theme, checking out whether they align well with the data. And finally, we found three important key themes from the interview, from what they said. They are the learning effects. There's something about the learning effects of the Digital Buddy program, and also the attitudinal effects of the intergenerational mentorship that we're very interested to learn about, and also the learning experience in the Digital Buddy program. So for the first theme, one of the sub-themes is the older adults' digital learning. It's very interesting. They said that we typically rely on them for just a few functions, talking about the smartphone, and like making calls, taking photos, but more advanced options and fundamentals of the functions. I mean, we really don't know much how to use it. Another very interesting quote is that they buy a smartphone. Some older people are really rich because they spend $10,000 to buy an Apple phone, and then their family member humiliated them that you have got a 10,000 phone, but you use 5,000 only. Another 5,000 are waste. So they feel very unhappy because they don't know how to fully utilize their phone. But actually, no need to feel sad. I can only 20% of my phone or two. So because there are too many functions in the phone, right? So that is to say, they enjoy the process, learning all these new functions. They are not very old to them, very boring, but very exciting things they wanted to learn. Another issue is they dare not to ask other people, even though many of them, they live with their family, younger people, but they just do not want to ask them, because what the feedback would be, the reply would be, oh, you don't ask me because you're very stupid, you don't ask me. So that they dare not to ask their family members, and they ask their peers do not know either. So this provide a very important, good platform for them to learn, for somebody to ask about. So, and also you said that after learning the WhatsApp functions from the class only, I started using other WhatsApp group. I was truly amazed. So my friends like, oh, you're so skilled. They feel happy because they are more skilled to use the WhatsApp. Another issue is they learned about how to use in the past. Sometimes they also downloaded the WhatsApp, but they don't know how to use the recording. Do you know how to send photos? So sending photos, sending audio records to their peers maximize their ability, or they can express the mind better, because better than just using typing text. So that also probably one of the reasons why they have got their mental health a little bit better. So another theme is about older people and younger volunteers' mental health learning. They all learned it about how to get more relaxed, and also to enjoy the process, talking to one another. In the process, talking to the older people, with the peers, and also the younger people, relax their mind a bit. And also they can ask about, practice those mental health literacy contents together with them. That also give them a more relaxed moment in mind. So the third is about younger people's mentorship learning. That is quite interesting too, because the young people said it is easier that the program relies on something like I'm skewed, because, you know, it is very difficult to recruit young people for volunteer work, but simply because some volunteer works need some new skills. But these young people think that, oh, you are just recruiting me, asking me to do something I'm very skilled at. I'm very happy to help. So another thing is having proactively to ask and interact with older people has improved my communication skill. I feel more confident and daring, because literature also said the younger people without adequate interactions with older people, usually there are some stigmatizations over them. They don't talk to you. They are very stubborn, something like that. So this kind of communications also enhance their understanding to the younger people. And also another younger people said their mental health can improve if they can share their own stories. So they can also see that through this mentorship program, they can invite them to tell more about their own stories, which might possibly help them to, having their stress relieved a bit, ventilate more. So another attitudinal effect is that they imply some stigmatizations of the older people too. You can see that we will ask younger family member for digital assistance, and they will respond with, "Oh, I've already told you that not to mess with your phone, not again." So that is a very negative replies from their family members when they need help, when they ask people. So they enjoy the kind of sensations. It's very sensational because you can feel how the older people are being neglected, marginalized because of their poor skills. And also another older participant said that young people always tell me, "You spend 10,000. I just mentioned that already, right?" Oh, this is a repeated one. So another theme is about learning experience, and the digital program is about participant social relationship building. So some quotes about they all actually enjoy, they don't just going together playing mahjong, but they come together to share with one another's own stories. So for example, this one, the duration doesn't really matter. And you know what? Giving us more time to immerse ourselves in it allows us more time to chat and exchange through each other. So this also provides very good opportunity for older people to talk with one another, not just about learning. And yeah, this is so nice to chat over the WhatsApp, but I think it isn't enough time for social interaction between older adults. So this person think that WhatsApp so it's good, but sometimes they also enjoy face-to-face interacting with one another. So both things work together, probably may enhance the interactions, connecting them with their community as well. So all in all, the recommendations here for older people after learning all this would be spend appropriate amount of time on socializing, exercising, and learning activities to help improve mental well-being. So we engage in learning digital technology and health informations to boost older people's sense of self-efficacy, prioritize self-applications in learning, enable older adults to engage in continuous learning. That is a very important thing that we might need to do to promote mental health, and promote opportunities for older adults to connect, participate in community, and help expand the social connections digitally and physically, both important. And for the organizational one, we recommend the government and organizations to allocate resources in long-term initiatives that provide training on digital mental health skills to increase awareness in elderly mental well-being. So this part might be missed. So we have established a center about digital mental health, and incorporate mental health elements into activities for older people. For example, integrating mental health awareness into digital technology educations to enhance older adults' understanding on mental well-being is also important. To establish sustainable e-learning platform like what we did to offer older people access to information so that they are allowed to learn at their own pace at their own time. So advocate for collaborative learning initiatives that bring together young people and older people to cultivate trust and promote intergenerational harmony, which was also advocated by many international guidelines and the literature. So more or less, here are the two apps that we can download using both platforms: the Google Play for the Android and Apple Store for the OS. So if you're interested, please download them and support us. So that's the end for my part. Thank you very much.
Thank you, Professor Rekwan, and thank you to our two other project team members for a thorough and detailed presentation on the implementation and evaluation of the Digital Buddy project. And I'm sure, through this presentation, ideas are already sort of firing off of how we might be able to improve on the digital and mental health programs for older adults. In the next section, we have a group sharing segment, and we have the privilege of inviting two mental health providers from the Kwai Ching district. They will be sharing their experiences and insight on this topic from the perspective of the community. Leading the discussion will be Professor Alex Chan, who will act as our moderator at this event. Professor Alex Chan is a dean and professor of the School of Arts and Humanities at Tonghua College and the co-director of the newly established Translational Research Center of Digital Mental Health. Ms. Kimmy Wong is the assistant center in charge at the Integrated Community Center of Mental Well-Being in Kwai Ching. And Mr. Loa Fo is a social work officer at the Kwai Ching District Health Center. Please welcome them both. Yes.
Thank you for the insightful and inspiring sharing from the project team, Professor Sally Chan, Professor Rick Grant, and Dr. Fao Yim about the framework, implementation, and evaluation on the evidence-based and meaningful Digital Buddy project. To facilitate, to have more in-depth professional sharing, these sessions will be conducted in Cantonese. For overseas participants, we will have colleagues to translate into English in the chat room. Not AI, a real person to translate into English. 你好，羅先生同埋黃小姐，你哋好。咁我諗見到數碼友伴能夠得以成功咧，其實都好多謝即係一啲長者中心同埋一啲地區中心嘅一啲嘅支持嘅。咁羅生，我知道其實大約有60位葵青地區康健中心嘅會員都參加咗數碼友伴呢個計劃嘅。咁佢哋對計劃有咩評價咧？好多謝你哋先。
多謝大家邀請啦，咁我都有少少機會分享下一啲前線嘅經驗咁樣啦。咁順便都介紹下自己先，我係地區康健中心嘅社工嚟嘅，咁都會負責跟唔同嘅 mental health project 咁樣啦。咁都多謝黎生咧，都親力親為，成日都即係自己教班咁樣，都好開心見到有咁嘅互動啊，係啊。咁咧都順便多謝東華學院咧，都好多同學仔會嚟我哋度 placement 同埋做啲義工咁樣，係啦。咁我分享下嗰啲評價先啦。咁咧啲老友記咧，其實嗰啲好需要學電話嘅，同埋咧就好想好大需求嘅。咁所以咧當初黎生咧過嚟嗰陣時，我哋都好開心啦。咁因為咧我哋本身中心都有啲係手機班咁樣嘅類似嘅，咁都希望佢哋咧學多啲嘢。咁咧就可能都會係 health related 嘅啦，可能教下醫健通eHealth HA Go 咁樣嗰啲 app 咁樣啦。但係咧黎生嚟咗之後咧，好有系統啊，因為咧啲街坊就係咁，即係依家就完咗啦，就係咁會問翻我嘅，黎生幾時翻嚟啊？幾時過嚟翻嚟再教咁樣，因為咧好有系統，同埋咧好長期嘅支援啊，因為大概係可能有10節左右咁樣啦。咁佢哋中間咧都學到好多嘢，咁我哋呢個係佢哋嘅評價啦，都寫咗好多感謝信啊，希望黎生咧再翻嚟教咁樣，係啦。咁我如果自己觀察嘅話咧，就見到啲街坊都做到好 inclusion 啊，因為佢哋成日都好驚會問人嘢，特別咧年紀大咗之後咧，就有少少收埋自己嘅，或者咧特別對於電話嚟講，佢哋統一嘅觀點就係好似啱啱都有講嘅，就係唔敢問屋企人，唔敢煩啲孫仔，唔敢煩仔女。咁唔敢即係問啊，咁所以咧有呢啲班嘅時候咧，就見到佢哋十分好啊。咁因為仲有啲後生仔嘅同學仔義工喺度嘅，咁所以咧佢哋會好積極喺堂上面問好多問題，就算唔關課程事咧，好多嘢問咁樣啦。咁見到佢哋有溝通係，即係作為社工嚟講咧，就覺得係好大得着咁樣啦。咁同一時間咧，我估佢哋都互相認識咗大家嘅，咁所以就都好共融啊，同埋即係可能不分年紀啦，咁大家咧一個學識咗咧，又可以教第二個啦，或者咧唔識嘅咧又教翻佢咁樣，咁成個Digital Buddy 嗰個計劃都 我覺得好好啊！如果有機會都可以繼續 long lasting 咁樣落去咁樣。
好啊好啊，我哋希望政府再撥款俾數碼友伴嚇。咁我見阿賴生都好受老友記歡迎，我想識阿賴生先啦嚇。我可能過多幾年都要揾阿賴生噶啦嚇。咁啊，不過真係聽見即係嗰個其實嗰個關係好緊要啊，即係長青共融呢個。咁其實即係當然佢哋老友記識咗嗰啲點樣用手機好重要啦，但係嗰啲精神健康嘅知識都好重要。我見到嗰個關係真係好幫助，佢哋真係減低咗佢哋孤獨感，同埋即係年輕人其實都一路成長，呢個都好重要。不過我哋見到啦，即係數碼友伴都即係服務咗1000幾個長者啦，係咪？同埋106位嘅年青人啦。咁但係校長提到喎，其實咧依家即係我哋嘅人口老化嘅情況都好嚴重，係嘛？即係佢依家都差唔多已經超過1/5啦，23、24%。咁我哋亦都知道，其實而家即係地區上都有好多獨居老長者啦，係嘛？同埋亦都有啲叫留守長者啦，啲仔女移民咗去外國咁樣。咁你哋覺得即係黃小姐或者羅生，你哋覺得香港依家長者面對最常見嘅心理健康嘅挑戰係啲咩咧？咁黃小姐先啦嚇。
好，咁首先我多謝東華學院邀請我嚟呢度同大家有個分享我自己一啲即係喺地區上高嘅睇法啦。咁我就係啦，嚟自精神健康綜合社區中心，我簡稱 ICCMW， 個名太長啦。係啦，咁我又講下 ICCMW 上高我哋對一啲長者心理健康上高嘅觀察。咁即係確實係嘅，正如頭先幾位 professor 都有講，我哋見到其實咧我哋見到通常嚟到我哋真係我哋 ICCMW 尋求服務嘅長者，好多時佢面對嘅壓力就係好多時就係一啲身體機能嘅退化啦，係啦，即係而嗰啲身體嘅狀況其實好多時係冇辦法逆轉，亦都係因為咁讓到佢哋對佢哋嗰個未來或者對個前路好似好冇晒希望啊，同埋亦都見到一個狀況就係好多咧時就係一啲退咗休嘅長者冇嘢做啦，佢個生活突然之間好似冇咗個方向，佢都好似冇個方向或者冇辦法，好似我應該由邊度着手係去重建翻我個生活咧？係啦，好似覺得我個生活就好似停咗啦。我退咗休，我就好似好似完咯喎，係啦，我喺呢度等唔知道幾時我百年歸老啦，係啦，都會有呢個狀況，同埋特別係頭先都有提到就係近年其實我哋即係自己浸信會愛群單位做咗一個小小的統計，就係咧真係近年移民為老呢個嘅情況咧係真係越嚟越嚴重嘅，係啦，咁我哋見到好多長者就真係家人移咗民之後，佢哋又會少咗個 support， 少咗個 social engagement 啦，即係平時以前可能大家都會多啲出嚟食飯啦，去邊度玩，而家屋企人真係移咗民啦，好似少咗個地方去，少咗啲人約喎，係啦，咁而種種嘅呢一啲咧，其實都見到係增加咗咧長者咧真係抑鬱症嗰個嘅數字，同埋咧亦都真係多咗長者係因住呢以上嗰幾種嘅狀況係多咗抑鬱啦、焦慮嘅狀況嘅，係啦咁。
多謝黃小姐。咁羅生咧？
因為如果以地區康健中心角度咧，因為我哋同好常見嘅個案都係身體有長期病嘅，咁令到佢咧心理方面其實都好多煩惱嘅，因為咧佢哋特別可能即係講開相關 digital 方面啦，可能因為醫院最近都可能轉晒有啲即係可能排隊又唔使去現場排啦，又可以有 HA Go 或者醫健通嗰啲 app 咧，佢哋又唔識用咁樣。咁所以咧呢啲問題都令到佢哋好擔心嘅。本身啲覆診可能已經好麻煩㗎，咁仲多呢啲嘢咧，令到佢哋更加擔心。咁所以咧都時不時我哋好恆常都會教佢哋即係呢啲方面嘅知識，令到佢冇咁擔心啦。另一方面就最擔心佢哋嘅心理方面嘅問題就係都係唔敢講咯，唔敢seek help 咁樣咯。咁所以就盡量都透過唔同嘅媒介，希望即係電話咧，其實我覺得就係一個好好嘅方法咧，即係氹佢講多啲，即係可能教佢開 eHealth 醫健通就問多啲，係咪有啲咩擔心有啲咩事或者最近幾次覆診咁呢啲媒介咧會令到佢講到好多，即係我哋未必可以直接問到佢問題出嚟咁樣咯，咁都係比較擔心嘅心理健康嘅問題咁樣。
係，咁我都聽兩位分享都聽到啦，即係其實身體都影響佢哋心理嘅健康啦，嗰種孤獨感亦都更加加強佢有種 homelessness 啦，hopeless 啦咁亦都即係見到即係佢哋可能數碼科技好多服務轉咗仔女又唔喺身邊，佢哋都有好多擔憂，又係 即係影響咗佢哋嘅心理健康。咁啊都好多謝兩位同埋你哋前線嘅同工啦。其實你哋都係友伴嘅一份子，去支持老友記真係好重要。哇！見到咁多挑戰嘅時候，我哋就諗啦，其實傳統服務單位我哋都知唔夠啦，唔足夠嘅服務，即係。咁有陣時啲長者，你頭先阿羅生都有講啦，佢哋都唔願意去即係主動去尋求幫助，或者都唔知點樣去尋求幫助嘅時候，你哋覺得地區中心喺提供長者心理健康服務嘅時候，發揮到一啲咩重要嘅作用咧？咁或者阿羅生你先分享先。
因為我哋康健中心就主要可能照顧身體方面多啲啦，咁可能心靈方面咧就主要係靠啲協作啊、合作啊，即係同唔同區機構合作啊，即係我樂心會咁啊，我哋都恆常有合作咁樣樣啦。咁就可能彈性大啲嘅，即係可能我哋收到一啲係身體方面有長期病啊，或者有其他病痛嘅長者咧，就可能會即係睇，可能係好表面咁樣，因為我哋可能嚟緊都有啲 plan 係可能好 pilot 咁樣做一個好大嘅 screening 啊，咁睇下會唔會好初步咁樣發掘到一啲係 mental health 方面有風險嘅街坊或者人士咁樣再 refer 去唔同嘅地方，咁樣同唔同機構合作咁樣咯。
好，唔該，劉生，黃小姐。
咁如果喺 ICCMW 嗰個層面，其實咧，即係因為即係見到咧長者嗰個精神健康嗰個狀況，其實真係越嚟越嚴重嘅。咁所以其實我哋其實即係淨係我哋葵青區呢一間，其實我哋咧其實有大概3-4成嘅會員其實係長者會員嚟㗎。係啊，講緊係 suffer 緊一啲真係精神健康嘅問題，係啦。咁其實我哋咧，其實因為我哋就即係 ICCMW，我哋即係都有個好處，就係我哋可以外展，我哋可以上門，係啦。咁即係有陣時有啲老友記佢真係佢個狀況可能醫嗰度根本出唔到門口，或者我已經周身痛到我都唔想行出屋企門口啦。我哋可以上門探佢嘅，我哋真係可以真係幫佢真係同個社會接連翻我哋由 worker 開始同佢有個 engagement 先，又將佢咧喺屋企度帶翻出嚟，再幫佢咧真係去聯繫到唔同嘅地區嘅 resources， 好似即係康健中心咁樣啦。身體嘅狀況可以揾康健中心有啲嘅幫手同支援，或者甚或乎係一啲其他嘅長者中心，佢可以有翻一啲咧meaningful 啲嘅 daytime engagement。咁同埋另一樣咧，其實就係我哋自己其實都同即係都知道咧，學院界其實都好做好多 research。咁其實我哋咧都有同唔同嘅學者真係去嘗試 develop 一套咧，真係專門係 for 一啲長者 mental health 嘅 protocol， 咁針對性啲嘅。咁我哋希望，因為其實即係我哋 ICCMW 嘅服務年齡實在好闊啦。咁我哋希望就住每個年齡層嘅需要，我哋可以針對性啲去介入，以至到幫助到佢哋咧，可以改善到佢哋個精神健康嘅。
多謝兩位分享。似乎即係我都睇到，即係地區中心其實無論喺診斷啊、預防啊，或者即係轉介去支援服務啊，甚至教育上邊都扮演非常重要嘅角色，係咪啊？咁啊，我哋院校都好希望即係繼續同繼多地區中心咧去合作，即係喺社區推廣嗰個精神健康嘅需要。唔單止長者啦，佢哋嘅照顧者，特別頭先黃小姐提及唔同階層嘅需要，精神健康需要。咁你哋覺得即係依家嘅長者心理健康服務啦，或者個政策上邊，仲有冇一啲發展嘅機會，或者有咩改善或者擴展嘅機會咧？咁啊，黃小姐啊，
咁我係啦，咁我嘅觀察其實咧，香港我覺得好好嘅就係咧，有好多好專業啦，同埋其實咧已經咧喺個地區上面運作咗好多年嘅，真係一啲嘅社會服務。咁其實大家咧都有住好多好豐富，同埋咧其實喺個地區上面吸收咗好多好好嘅經驗啊。咁其實大家亦都好有自己專業化啦嘅一個系統但係有陣時我哋就係譬如長者中心，或者我哋精神健康綜合社區中心，又或者地區康健中心大家咧一個長者好似嚟咧就係我又要去呢度，跟住就去呢度，跟住就去呢度。有陣時咧啲老友記都會頭問我都唔記得咗我琴日見咗邊個姑娘或者見咗邊個阿 Sir 啦。係啦其實如果咧我哋真係能夠有一個將呢啲資源有得統整其實大家做緊一啲好好嘅嘢。大家咧如果可以將呢啲經驗有啲嘅分享個老友記我嚟到淨係去一笪地方，或者就去2個地方，我已經咧可以咧有晒呢啲咁多嘅支援，可以已經入咗嗰個地區安全網啦。係啦，咁咧咁就成個資源就可以互相咧就可以運用得好啲，又可以便利到個長者，大家咧又可以咧真係補到咧唔同嘅窿窿咁樣樣。
多謝黃小姐，呢個好重要啊！聯盟同埋共享資源啊，呢個係非常重要啊。好，阿羅生，
咁喺我哋嘅角度，可能就可能爭咁個 prelim 嘅可能巨型大型嘅 mental health 嘅 screening 咁樣咯，即係可能係咯，如果有個咁嘅 pilot 嘅 scheme，可能就可以揾多啲高風險嘅 mental health 嘅人士出嚟啦。咁另外就可能多啲即係可能多啲digital buddy 咁嘅計劃咧，其實都幾好嘅，係啦，都幾幫到手咁樣咯。
係好，非常重要嘅呢個，我都覺得一個大型嘅 screening，因為有啲確實係可能係 hidden 嘅。隱蔽嘅，咁我覺得重要嘅。咁我諗我哋都需要，我諗學院啊，或者即係一啲專家啊，即係精神健康同埋地區中心啊等等。我覺得我哋都需要有個 advocacy group 同即係政府講，即係需要一個咁大型嘅 study，即係其實係對成個社區都好有幫助，對成個香港嘅精神健康係啦。咁其實咧。我哋除咗即係真人嘅即係 buddy 之外咧，其實我哋數碼科技都係我哋嘅 buddy 嚟嘅喎。咁呢度俾我賣個廣告先。咁其實咧我哋個學院咧都成立咗一個數碼精神健康嘅轉化研究中心Translational Research Centre for Digital Mental Health。咁我哋都希望咧呢個中心咧其實我哋1月成立㗎啦。咁我哋而家希望日後我哋會做多一啲更有 meaningful 嘅 project， 可以支持到社區嘅精神健康嘅一啲 promotion、prevention 甚至乎可能 screening 日後我哋都希望同地區組織其他院校一齊合作。咁我哋都想講啦，咁頭先即係校長團隊都有 present 或者 digital buddy， 我哋見到數碼科技嘅發展其實對心理健康服務咧都係一個正面嘅正面嘅影響啦咁你哋覺得，譬如你哋喺地區組織上邊你哋發覺社區地區中心上邊，你覺得對於長者嘅精神服務有啲咩嘅正面嘅影響咧？羅生
嗱，咁我都順便賣個廣告啦。如果大家咧有任何 project 咧，都可以同我哋合作下咁樣咁係。咁另外就係對如果長者嘅話，就係其實就咁樣電話咧已經好幫到佢哋手，因為我覺得作為一個媒介咧，好容易去 connect 佢哋，因為佢哋依家就係好缺乏或者好擔心唔敢用電話啦，唔識用啦，好驚中毒啦，好多人打俾佢啦。咁其實只需要咧同佢哋講咧，即係可能唔使擔心啊，我教你啦。其實一句咧，佢哋已經即係好信任你嘅，已經就好似即係如果以前爭咁啲媒介咧，就好難去入到佢哋嘅世界。但如果用電話咧，佢哋好似就偏向好信任你多啲嘅。其實可能教下佢好多嘢咧，慢慢咁咧，就個關係都幾強嘅。同埋特別咧，可能 WhatsApp 咧，大家其實好多長者老友記咧，個個都有噶啦。咁所以咧，我哋揾佢咧，唔再需要擔心揾唔到佢啦。即係我哋 WhatsApp 佢咧，佢又識覆翻咧，就已經覺得safe 啦，即係安全啦。咁樣咯，係啦，
好多謝，係。
咁係啊，我都好同意，就係個電話係一個好重要嘅媒介，因為即係而家應該人人都有，同埋咧，其實你行到出街，你去餐廳都係要嘟 QR code 噶啦。所以智能電話呢一樣嘢真係係一個好普遍，係好普及嘅工具嚟嘅。咁所以正如頭先我哋嘅觀察都同阿羅生一樣，其實我哋見到好多老友記咧，其實佢用智能電話上面有好多擔心啊。如果我哋喺呢個上高幫到佢嘅話，第一佢哋可以真係覺得自己唔係咁脫節啦，對佢哋咧建立翻自己嗰個自信其實好有幫助嘅。同埋另一樣嘢就真係增加咗咧，佢真係同人與人之間嘅聯繫。我好記得我哋即係有遇到一啲老友記就係佢好 depressed 嚟到，就係因為佢冇辦法女移咗民，帶埋啲孫仔孫女，咁佢冇辦法再真係同佢哋有個聯繫，但係真係學識咗，原來而家仲有樣嘢叫視像通話㗎喎。係啦，佢真係即刻開心晒，成日咧真係走去咧就阿女又好，即係定佢同佢真係去 video call 佢。咁我覺得呢一樣嘢其實真係可以幫助到咧，即係啲老友記咧，佢可以真係增加翻同人與人之間嗰個聯繫啊，增加翻佢個社交啊。咁而佢哋有陣時其實都好叻嘅，有啲其實學識用 WhatsApp 之後，佢哋會邊度下邊有嘢派 WhatsApp 係啦，喺個群組入邊，邊度樓下有嘢派快啲一齊去啦，咁就一齊就去啦。咁其實讓佢哋個生活上面咧，其實真係多咗好多嘅趣味，同埋真係多咗好多陪伴。
係啊，因為我自己都有個85歲嘅細媽，咁我都而家都教緊佢用 WhatsApp 嘅，咁其實幾好嘅。一方面我哋出去食飯，因為有陣時佢有少少 dementia，咁都係有陣時近期嘢唔記得，但係佢影低咗啲相咧，即係大家一齊出去食飯咧，佢睇翻又會有啲 savoring 一啲細味嘅感覺，令佢開心啲。同埋嗰個 WhatsApp call，而家教緊，我叫工人姐姐教緊㗎啦，咁希望佢都識用啦。 咁啊，係啦，咁啊，我哋都覺得真係好重要。咁我都賣個廣告先。其實咧，除咗手提電話之外咧，校長Professor Sally Chan、Professor Rick Grant 同Dr. Fao Yim 咧，佢哋依家又進行緊一個新 project，係用 VR 係咪 VR 係嘛？係啦，即係點樣一啲去旅行啊，或者去戶外一啲環境啊，咁啊俾即係長者去玩嘅。咁啊當中咧幫助佢哋提升佢哋精神健康係嘛？咁我哋都睇下啦，繼續落去。其實我哋覺得無論我哋東華學院啦，我哋想都同地區中心或者傳統服務單位或者其他學院，我哋都可想更加即係善用呢個創新科技去支持長者，甚至乎佢哋照顧者嘅精神心理健康啦。咁我想都問下兩位，你哋覺得有咩意見俾我哋咧？即係喺呢方面點樣可以加強合作咧？或者黃小姐你可以分享啦。
咁我覺得好好啊，就係我覺得睇下即係將來即係大家點樣可以喺一個 research 嘅層面啦，係啦，因為即係其實呢方面即係我哋即係地區嘅 NGO 確實真係唔專業嘅，係啦，真係要靠學院係即係點樣喺一個 research 上面，讓我哋真係咧認識到多啲真係而家 overall 其實一個長者精神健康，即係我哋好了解到前線個狀況，但係一啲真係好似頭先羅生所講大規模啲嘅 screening 啦，就係啦一個整體嘅狀況，我哋點樣係有一個整全啲嘅picture 去睇到，以至到幫助到我哋係個服務係可以點樣再配合到多啲係啦，即係長者個精神健康嘅需要啦。第二樣嘢就係即係好欣賞其實學院咧，其實好多時都係有好多好 creative 嘅嘢嘅，係啦。咁有陣時我哋做前線其實有陣時會好慣咗用一套嘅模式，係啦。咁但係有陣時bring in 一啲新嘅嘢俾我哋，其實我哋又可以帶翻落去俾我哋嘅服務使用者。係譬如我覺得頭先即係例如數碼友伴呢一個計劃啦，其實好 interesting。其實我哋自己有少少分享，我哋自己咧都有做一啲少少類似嘅嘢。不過咧，我哋就係用長者 buddy，但係咧其實就數碼友伴呢一個 project 咧，其實就俾我哋做咗我哋啲細規模嘢。係啦，就更加之全面啊，同埋其實係一個好整全嘅方法咧，去讓咧真係長者係去點樣好有系統去學到真係一啲知識啦，無論係 mental health 定還是手機。第二咧就係真係增加咗佢哋同真係跨代嘅嗰一個嘅交流同埋共融。咁我哋希望可以真係可以有多啲呢啲真係好 creative，然後又好有趣，同埋其實一路聽一路都覺得好 exciting 嘅。係啊，咁呢啲有趣，其實長者我都覺得係嘅。佢哋最需要其實有陣時，佢哋好似退咗休或者個步伐慢落嚟啦。其實我覺得佢哋更加需要就係嗰一份即係 exciting 啊，係啊，咁嗰個讓佢哋生活入邊多一份刺激，多一啲新嘅嘢咧，我覺得對佢哋嗰個精神健康都係有幫助嘅。
係，多謝。呢個
係我哋就其實 Digital Buddy 咧就推動埋我哋嘅，因為咧就其實坦白講，我哋本身都好多手機班咁樣，因為知佢哋有需求嘅。但係咧，我哋啲同事咧就冇乜系統嘅，諗到咩教咩。有時我都會教下咧，就佢哋會問嘅，佢話羅生又搞呢啲啊咁樣。咁所以咧，即係依家咧，我哋都即係 Manfred 都好好啦，可能 share 咗啲資源俾我哋。特別個 app 咧，如果開啟咗咧，即係可以俾大家咧都好似幾有用嘅咁我見到。咁所以咧，就依家比較有系統嘅，即係可能幾時講咩課程，講啲咩 topic，咁我哋都即係好有參考性嘅。咁我哋都會跟住咧，即係推動埋我哋去即係革新啲啊，好啲咁樣咯 ，improve 咗我哋咯。
係其實而家啲老友記好有要求㗎，佢哋都好醒㗎，係嘛？佢哋學咗之後，其實佢哋都會去幫助其他友伴嘅嚇。咁另外，我覺得都好緊要嘅，即係嗰個長幼共融長青共融都好重要嚇。咁可能我哋有陣時揾啲細路仔，我啲青年人都好犀利嘅，中學啊、小學嗰啲。咁我諗好緊要嘅，其實長者喺個關係嘅當中，其實佢哋有陣時需要人哋傾訴，或者佢會講翻人生嘅經驗歷練係咪？佢哋面對困難挑戰，其實都係幫助緊年青人成長嘅，或者幫助緊我哋去成長。咁希望我哋可以繼續多啲合作無論我哋東華學院可以繼續可以同地區中心啦一啲專家啦，或者其他嘅院校喺呢方面可以多啲合作，甚至乎用更多善用創新科技即係知道老友記都有需要有要求嘅時候，希望幫助佢哋唔單止佢哋嘅精神健康即係佢身邊嘅人嘅精神健康或者家人嘅精神健康都好重要。咁我諗一個正向一個豐盛嘅晚年咧，我諗對於我哋地區嘅長者都係老友記都係非常非常重要。盼望我哋一齊努力咁都好多謝，再一次多謝兩位阿羅生同阿黃小姐，你今日俾我哋
And as our time comes to a close, I would like to offer us a bit of conclusional remarks to all the viewers at home and also ones joining us at the KPC this afternoon. Once again, I would like to extend my appreciation for the funding and support provided by the Advisory Committee on Mental Health from the Health Bureau, which has made this event and the impactful outcomes that we've just saw today possible. As we conclude this seminar, let us carry forward the ideas that we sparked today to continue to work towards the digital inclusion and the mental well-being of older adults. Hope to see you all at Tomahawk College again. Bye-bye. Bye for now.